Early in the pandemic, I talked with my mom who lives in the same rural village in Rwanda where I grew up. I asked her how COVID-19 was affecting our community and whether she was following the safe practices around social distancing and staying home. Of course, she said. How can I go outside with the teachers out there? Keeping what? The teachers? And I flashed back to my own youth and how the teachers understood the situation of every household in my village and the kindness and the support they offered when we children were too hungry to stand. Along with my friends and colleagues, we founded a non-profit known as MoveUp Global. Today, this organization has begun working with the teachers as frontline responders to COVID-19 pandemic. We see this as an essential element of an equity-based pandemic response. By now, we all should know that the action of every individual is crucial for pandemic control. To slow and eventually stop COVID-19, we health professionals ask people to socially distance, to use a personal protective equipment, PPEs, and if they are sick or exposed to someone who is sick, to get tested immediately and to quarantine and self-isolate, and frequently wash hands with soap and clean water. When we ask this, we are often asking the impossible. Asking the impossible of people who live in a multi-generational households or crowded conditions, who have no money to buy soap, and who often are food insecure, and who have no access to PPE, and who need to walk long distance, hours and hours to visit a nurse or a doctor. An equity-based response ensures that everyone both knows how to protect themselves and protect their families and has the means to do so. Especially in impoverished areas of Africa, whether urban or rural, teachers can play an important part in implementing this response. With over 65% of the population under the age of 35, Africa has the youngest population. This is about 133 million. Many are in school, and although many schools have no nurse, no counselor, no doctor, they have the teachers. And Africa's youth spend more time with the teachers than anyone else outside their family. It's teachers who know best their household situation and what steps needed to respond. The question is how teachers can play a role by virtue of their proximity to the community, of their skills as educators, and of their commitment to their students and to their social welfare. Teachers are the best suited to be rapidly trained and equipped as a greatly expanded public health workforce. An expanded workforce is needed right now, more than ever before. You see, while 445 healthcare workers are recommended for 100,000 people, the World Health Organization reported that 46 out of 47 countries have significantly less than this figure. For instance, in Rwanda, there are 10 doctors for every 100,000 people, while in Kenya, there are 20. In Botswana, there are 40. So now, if we want to rely on conventional roles and training, it would take decades and decades for the healthcare workers to be prepared and to be able to respond to pandemics alone. In my community, efforts are underway to train teachers to screen their students for COVID-19 and neglected tropical diseases. Teachers are designing a robust soap-making project, school-based soap-making project to enhance hand hygiene conditions. Such actions must be taken on a grand scale. You see, when 70 children file into a classroom, 70 families are in the same room. Teachers must be given the tools they need. Every teacher should be armed with the necessary knowledge and skills to detect and prevent the spread of COVID-19. Teachers should have thermometers, should have PPEs to protect themselves, protect the students, and most importantly, have an emergency response kit for at-risk families. The question that you may have now is, are teachers up to the job? Absolutely. The reality is that life will never be the same. In education, as in every sphere of life, we must have an adaptive response. And this includes an adaptive curriculum. In many African countries, the public school curricula now being used is the same taught 50 years ago under the colonial rule. It's time to adapt. And the pandemic preparedness and response should be a core component of health education. For teachers, this will become an integrated new skill set and a competency that they can pass on to their students. During pandemics, the best way to show a universal compliance to infection control measures is to show an example. And teachers can do that. It's what they do. COVID-19 is not the first, and for sure, it is not the last pandemic. We've had cholera, HIV/AIDS, TB, Ebola, and now, a few years after Ebola, we have COVID-19. I have a privilege to serve as Deputy Chief Medical Officer at Partners in Health, a global health organization which champions social justice. And over the past 15 years, my team and I designed strategies to enhance health systems across over 10 countries that we support. In all pandemics, building and deploying a robust community workforce, including community health workers, teachers, faith leaders, traditional healers, has been the secret of our rapid response and remarkable success. The best way to be prepared for the next pandemic is to think ahead and build an extended workforce which can make a real-time change in the lives of students and their families. If we need this change, an intentional adaptation of our public health programming has to happen. First, it will need some humility, a willingness to recognize that teachers can do or do more than the writing on a blackboard. Building a strong linkage between health and education system, that will have to happen. And finally, it will require us to adapt the national policies and to embrace the role of teachers as extended workforce. Teachers are one of the beloved communities, and they model the behavior, the values, and the essential knowledge needed to build a better world and to survive a pandemic no matter your income and station in life. Thank you.